started recording, okay, as it's just turned 2 o'clock.
Okay. Good afternoon, everyone, and welcome to this meeting of Social Care, Health and Wellbeing Scrutiny Committee on the 9th of December. So, Charlotte.
Sorry?
We're actually here on the wrong date there. So obviously I'll start again.
Apologies.
Obviously, good afternoon and welcome to this meeting of the Social Care, Health and Wellbeing Scrutiny Committee on the 20th of January 2022. Just to make you all aware, today's meeting will be recorded. Can I also ask all members of the public and press to today's meeting? And can I kindly ask you to observe the meeting only and not speak or participate? I would also like to welcome members of the education. Have we got education and that?
No, Chair, just missed that part out. Just take that bit. Just ignore that. Apologies.
Right, just ignore that then. Obviously, but we are obviously welcoming all our speakers today. So can I also remind you to switch your mobile phones to silent for the duration of the meeting, and also can I refer to you the protocols for remote meetings which have been previously circulated, namely your microphone should be switched off or to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams. I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? The first item on the agenda is to do a roll call. I am Councillor Charlotte Goldsworthy. I will be substituting as chair I am present. I will now call upon Charlotte of Democratic Services to take the roll call.
Thank you, Chair. So I've just marked you as present. So I've had apologies from Councillor Purcell and I've had apologies from Councillor Arthur Davis. So if I move to Councillor Oliver Davis.
Present, thank you, Charlotte.
Councillor John Miller.
Present, Charlotte.
Councillor Suzanne Patterson. No. Councillor Sonia Reynolds. Councillor Reynolds, are you there?
Yes, thank you, Charlotte.
Sorry. Councillor Dave Whitelock.
Present, thank you, Charlotte.
Councillor Alwyn Wilcock.
Present, Chair.
Councillor Carolyn Edwards.
Present, Charlotte.
Whittington Griffiths.
Present, Charlotte.
I've had apologies from Councillor Helen Kerry Clark. Councillor Nicola Davis.
Present, Charlotte.
And then if I move to Cabinet members, Councillor Alan Lockyer.
Present, Charlotte.
Councillor Peter Richards.
Present, Charlotte.
And then if I move to officers, Andrew Jarrett.
Yeah, I'm here, Charlotte.
Angela Thomas.
Present, Charlotte.
Kerry Warren.
Out, present.
Kerry.
Yes, I'm present.
Thank you. Christopher Davis.
Present, Charlotte.
Rob Davis.
Present, Charlotte.
Leigh Howard. Shelley. Oh, John Hodges.
Shelley, apologies from Shelley, she's unwell.
No problem, thank you. John Hodges.
Present, Charlotte.
Paul Coakley. Adrian Bradshaw.
Yes, present, Charlotte.
Dina Richards.
Yes.
Thank you. Joanna Hall Davis.
Oh, yeah, I'm here.
Rep Griffiths.
Yes, I'm here.
Ian Jones.
Afternoon.
Nicola O'Sullivan.
No, Nicola isn't here.
Problem. Kelly Gillens.
Yeah, present, Charlotte.
There we are. Have I missed anyone at all that's participating in today's meeting? I've just realised, Tammy, I've not called you out.
That's okay, Charlotte.
Sorry.
I'm present. Thank
Charlotte,
you.
Charlotte, this is Paul Coakley. I missed you then, sorry.
Apologies, there we are. I'll mark you as present as well. Have I missed anyone else at all?
Yeah, there's
Chris
Vice Chair.
O'Malley from the Carers Partnership Board.
Chris O'Malley, there we are. And who else was it? Did I miss someone else? No? Then Chair, I think that's everyone then.
Yeah, so we only have one item on the scrutiny agenda today, which will be scrutinising. And we've decided to scrutinise items 7, 8 and 10. There obviously isn't any members that obviously didn't miss pre-briefing, so obviously we'll go straight into the declarations of interest. So can members please indicate whether you have any declaration in relation to the items that we've chosen to scrutinise? Charlotte will circulate a declaration of interest form via email for you to complete. From my understanding that we have none, Charlotte?
I can't see any, Chair.
Yeah. There are two sets of minutes on the agenda for approval, the 16th of September 2021 and also the 9th of December 2021. So can I ask any members if they have any comments they wish to make in regards to the minutes? And if not, can I have a proposer for the 16th of September 2021, please, and a seconder?
I propose.
I second.
Can I also have a proposer and a seconder for the minutes of the 9th of December 2021?
I move.
I propose, Chair.
I second.
Thanks. The only item we have now, and I want to welcome them, are Sean, Harrop Griffiths and Steve Jones from the Health Board. Obviously that we have asked and they've kindly accepted to discuss obviously the proposals to change older people's mental health services. Obviously before we invited them to attend. Obviously I think all members in the meeting today also did attend the seminar. I think it was a week last Tuesday by the Health Board, where obviously this was mentioned. So again, lots of the questions that we originally had were answered then, but we do have a few questions again for you. But if any officers have anything to say, we can go straight into questions if you want, or if Sean or Steve have anything to say first.
Chair, can I come in? Thank you,
Yes.
Sharon. Yeah, so just go back then, a bit of context for this. I know members will know, but it's important for the wider committee. So we brought a number of meetings ago the response that we gave as a social services department to the Swansea Bay University Health Board Older People's Mental Health Consultation to Scrutiny Committee. And I think Scrutiny Committee had a number of issues, if I remind you. The issue, first of all, was why hadn't the consultation come to Scrutiny panel, and why hadn't the Health Board addressed something to the Scrutiny panel? Second thing was, ostensibly, the consultation was around the closure of hospital beds. It's more complex than that, but the closure of hospital beds around older people's mental health, and the looking to centralise the remaining hospital beds for inpatient care in Kevin Coyd. Now, again, members were concerned about that location, and they, whilst they recognised the intent to provide additional community support, they were concerned about that as well. So, so that's why we or you invited as a committee the Health Board to come and speak. I think you did write a letter to the Chief Exec of the Health Board and requested attendance, and that's happened today. I mean, to be fair to the Health Board, I think they did listen to a lot of the consultation at the time, and they paused their action and actually went back out for a broader request for consultation and the results of that haven't yet, as far as I'm concerned, been announced. So the health board did agree to stop and pause based on the responses from this committee, the other consultation documents that they received from other organisations and members of the public. So that's why we're here, Chair. I just wanted to put that into some sort of context for those who maybe didn't attend the meeting on the last occasion.
Thank you, Andrew. And again, I think I want to say a big thank you to the Health Board on that as well. And I think, obviously, by listening to concerns that were raised, obviously, I think it shows what true, genuine partnership and collaborative work now that is being done between local authorities and the Health Board, as well as obviously key stakeholder partners as well. So, Sean, you're going to hand it. So, if obviously, I'll over to you now.
Yeah, so very briefly, I'll just say something and then I might ask Steve to just give a very, very brief introduction before we go into questions. And yes, thank you again for the opportunity to come and talk to you today. Just to recognise, as you've said and as Andrew has said, then the outcomes of the public engagement. So I think we need to recognise from a health board perspective that there is a difference between public engagement and public consultation, formal public consultation, in terms of the arrangements that we have agreed with the Community Health Council in terms of the level and formality of the engagement or consultation that's undertaken. So it was engagement rather than formal public consultation that we did last year. But as you say rightly, because of the concerns that were raised, we paused the engagement and agreed to undertake more work. And one of the reasons that we also agreed to pause it was because of the low numbers of responses that we received. We had, only I think it was 35 formal responses to the engagement. So that's part of the reason that we decided to extend it. The other thing I just wanted to reflect, and I did mention it when we had the briefing session last week, which you referenced, was and apologies if this was an omission on our part. We clearly circulated the engagement document to the council, to the local authority, and I suppose our understanding was that the local authority, the council, would have sent it to whatever committees it thought needed to consider it as part of that process. If that's not the case and we got that wrong, then I apologise for that, and we will make sure that we add this committee to our circulation list for further engagement and consultation documents. So I just wanted to reference that as well. But Steve, do you just want to briefly sort of provide a bit of an overview of what we've done since last time and some of the main proposals?
Yeah, I'm happy to do that, Sean. I suppose in summary, the backdrop for all of this is an investment in community services across the Swansea Bay area, particularly in the older people's arena. And I suppose from a patient experience and care experience backdrop, that will be to ensure that people are cared for closer to their home, are able to remain in their homes for a lot longer, and the skills and necessary services are delivered at the point of care. So there's been investment historically through additional funds that have come into the health board or come into us as a service group within mental health, that we've invested in the community to enhance our CMHTs, the care home in reach team, etc., reaching into care homes. That's seen a residual benefit, as I'm sure you can understand and imagine would happen when you're caring for people in their home environments. They stay there longer, which obviously is a better experience for them. The result is a less of a use on inpatient beds. And I think what we've seen over the last few years is a reduction in the use of our inpatient facilities because those referrals aren't taking place. That's the long and short of it. We have then considered that position. We are wholly committed to investing further in the community for the reasons I've outlined. That will mean that we need less beds, and therefore it would be prudent of us to reduce our bed capacity. I pick up on the point that Andrew mentioned earlier on about TONA and the centralising of services. I think I suppose the only way I can explain it is if you've had a wander around the facilities within Tonner and you've had a wander around the facilities in Cefn-Coed, you'll realise that they are poles apart in terms of what they offer as environments. So the unit on Cefn-Coed site, Ysbryd-y-Coed, is a state-of-the-art facility that's been purpose-built for the care of people in older age who present with psychological and mental health difficulties. Whereas the site on Tonner, which I'm sure you're all aware of, is an aged environment that has had some sprucing up, but it will never be in comparison to the facility that is there in Ysbryd-y-Coed. I think the challenges then are where do you provide the best care for the patients that need access into specialist services within secondary care, and hence why the centralisation would be in a Cefn-Coed site. I think that's a broad summary. There's obviously a lot of detail that would be involved in where we have gone on our journey to bring us to this particular point, and the progression into the modernisation plan that we want to take forward. I hope that's enough, but I'm happy to add any more if you need any further detail.
Thanks for that, boss. I've got John Miller who wants to come in.
Thank you, Chair. I'm looking at our papers on page 17, where it explains that, you know, there's where the beds are going to change for the older people. Forgive me if you've already outlined this, but you're losing 37 beds. You say where the beds are, i.e. Tonner and Swansea, Ysbryd-y-Coed. Can you please explain where the beds are being lost from? Thank you, Chair.
I'm assuming that question's for me. I was looking to see if Sean was going to come in. So I suppose in essence what the paper identifies, John, is that the beds are currently on the Tonner site. We've had a temporary closure of one of our wards on Tonner because of the lack of use and the availability of staff. So there's one ward currently open on the Tonner site. There are 3 wards open on the Cefn-Coed site in Ysbryd-y-Coed. The loss of beds would be on the Tonner site, as I was alluding to earlier on, because of the quality provision that's available within the Cefn-Coed footprint.
Thanks for that. John, do you want to come back on that? No? Okay, thanks. Caroline?
Thank you, Chair. I'm having trouble with my mic. Well, to be frank, I'm not very happy with this at all. We're losing 37 beds. There will be only 15 in Tonner. I worked in Tonner many, many years ago, and I've worked on community. You know, we have valleys in Neath, Talbot. Access to Cefn-Coed is really difficult for patients, residents. Many of these patients will have elderly carers too. Some of them won't have transport. They won't have anybody to take them to Cefn-Coed to visit and so on. So I'm really very, very concerned about that. As I said, I worked in community, and I know that over many, many years, there's always a promise of investment into community care, and it never ever happens. It would be wonderful if this did happen this time. The other issues, I think, are problems with home care, domiciliary care, home care, nursing teams. You know, we've all got staffing difficulties at the moment. Staffing difficulties before COVID, but it's even worse since COVID. So that's a real concern for me as well. I appreciate what you're saying about Tonner, but we have a fairly new hospital in Neath. One of those wards, I believe, is being closed there. That would be nearer for our valley communities. But I think to place patients in Cefn-Coed when they come from the top end of the Neath Valley or the top end of the Avon Valley, Swansea Valley is not acceptable, to be honest. There's no equality of care there at all. Thank you, Chair.
Right, Sean, do you want to come back in there? Or Stephen? Both of you got your
Shall I-
hands up.
Yeah, shall I start? Sorry, shall I start, Steve, and then you can fill in my gaps. So yeah, thanks, Carolyn. I think one of the things that's really important is that we would expect people to only be admitted to Kevin Coyd for the assessment element of their care, so for a shorter period of time, and Steve will be able to expand on that. In terms of the transport, I think it is a challenge, isn't it, transport? And when we talked about it last week at the briefing, we talked about needing to have a further discussion with local authority colleagues around transport more generally. We have put in arrangements to enable people to have transport to Kevin Coyd if they need it, and for relatives and carers. And that started before Christmas in early December. The staff have been advertising that widely and making sure that relatives and carers are aware of the arrangements that we've put in place to enable that. That hasn't been taken up at all. So if there's anything more that we could be doing to make people aware of that, then we'd welcome that. But we will continue to make sure people are aware of that. We said that we'd put it in for an initial 3-month phase and review it, and we'd be committed to maintaining that if that was helpful. I think just in terms of the reduction in beds, I think just to say again that the beds, we have less than 3/4 occupancy of the bed capacity that we have at the moment. So it's not as if those beds are needed to deliver the level of care for patients. And I think one of the things that's really important, and again, Steve might want to elaborate on this, is that this is for the very highest end of people's need. So it doesn't address, you talked about domiciliary care. Clearly we work really closely with Andrew and his team around community services, but I think it is important that these beds aren't the general beds that you would find in nursing and residential care homes. They are for people at the highest level of need. But Steve will be able to elaborate on that.
Thanks, Sean. Thanks, Caroline. A number of points just to pick up. Apologies if I was slightly misleading in my earlier answer to John. So there are still beds on the Tonner site, as our paper identifies. There are 15 beds left. They're in a newly refurbished facility. I was trying to emphasise the fact that we need those modern facilities. So just to highlight that, I suppose to pick up the point about community investment, having been around the service for many, many years, Carol and I agree with you in terms of investment. I think as Sean has highlighted, the reduction in the use of the beds, which is what we're considering as part of our modernisation, is evidence of the fact that that investment into the community is already taking place. So it's not as if we're trying to draw out of inpatient services to put in the community. We've already put in the community, and the residual effect is less of a pull on our inpatient facilities. So I would still concur that there is probably more that we can do, and there always is. And I suppose the more money that we get, we would then invest in the community further. So certainly pick your point on that. I've covered the Tonner beds and that refurbished facility. I suppose the other thing just to highlight is what Sean identified in her last comment. As a result of COVID, we're having to manage our admissions into inpatient facilities across all spheres, but in this case, in older people's, in a very different way. It has been to manage the pandemic and the transmission of infection of COVID. So we have a single point of access ward on the Kevin Coyd site, which is the transportation issue that Sean has alluded to. What we have instilled within our single point of admission is 14 to 28 day stays and then move on to treatment wards. We try and keep that to 14 days. That, as you would understand from all the other information in the community, that's the incubation period for COVID. So that's why we've used that as a benchmark at this stage. Patients are then transferred into treatment wards, and hence why Tonner and the current ward that's open on Tonner is used as that facility. So it is those short-term assessments rather than the treatment of individuals. I think the other thing to pick up from that, Caroline, is what we're seeing is that we are dealing with the most complex individuals that need admission into inpatient facilities for secondary care, because a lot more of the lower end of the spectrum can be managed within the community because of the resources we put in there. And then the final point, if I can just try and edge that off, is the issue about staffing. I absolutely, again, agree with you. Being the director of nursing within mental health, obviously I have a responsibility for the nursing element of that. It is a challenge. It's a challenge day by day. We're in a current position where our vacancy factor turnover is at about 8%. That's normal. So we're managing it within normal parameters, is what I'm saying. And we manage our vacancies quite efficiently. And we've got lots of strategies that are in play to look at those going forward. So hopefully that gives you a level of assurance around that.
Thank you both. Anyone else got any other questions? Caroline, John, anyone wants to come back in there? No. My own personal views and concerns on this is, obviously, as you know, I sit on the CHC as well, and I think a lot of the work that's been done is great, but, and that's a big but, in this current climate, we haven't actually done a full analysis of where we are with mental health in our communities due to COVID. And I think when we look at referral waiting times, those who are suffering, but again, live on their own, and they themselves don't know that they're suffering and need that support, and what happens to them. So it's all well and good saying you've got empty beds, transport is an issue, you know, and again, over the years, people have tried starting plenty of community initiatives with, you know, transport, volunteers and everything else. And what my biggest concern is that these changes are not going to be putting more pressures on social services, because I'm all for in the community, keeping them all in the community and everything else. But if that is the case, then obviously money from health also comes with it. And I think that is, you know, true collaboration as well. So I think obviously, you know, this is going to be interesting going forward. And I think that together we can obviously make a difference and improve services and everything else. But there's just a few concerns I personally have. Sian?
Yeah, just briefly, and again, Steve, it might be helpful if you comment on the impact of COVID on mental health, because you're absolutely right, Charlotte, that is something that we're looking at. So just in terms of impact on social services, as I mentioned, we do work really closely with Andrew and his team, and also Dave and the Swansea team through the Regional Partnership Board. We have got joint planning arrangements in place for mental health services, and one of the pieces of work that we are doing at the moment is starting to develop a strategic framework for older people's mental health services, and we'll clearly have to look at the funding arrangements as part of that. That work was put on hold because of COVID, because people were deployed to respond to COVID, but that is something that we are picking up, and there is separate funding coming through from Welsh Government for dementia services. The other thing I was just going to mention in relation to that was this is actually the fourth time that Andrew and I have been together today in different meetings, which shows how closely we're working together. And in the last meeting that we had, which was with Mark Hackett, our Chief Executive, and the Director of Social Services from Swansea, we agreed that we would do a short piece of work to look at EMI services across the region, in terms of some of the additional interim work that we could potentially be doing, because I think there is a recognition that some of the residential and nursing home capacity there are shortages of that in some parts of the region. So we did agree that we would do a shorter term piece of work that. But again, that's a different
Yeah.
that's a different group of people, which I think we just need to be careful that we don't muddle up. But Steve might want to mention the impact of COVID.
Thanks,
Yeah.
Sean.
Sorry, Sean. Happy to pick that up. I think you make a very valid point around COVID, and I think within the mental health world, we almost have anticipated a tsunami of referrals post-pandemic. Clearly, the waves that we're currently experiencing hasn't allowed us to fully understand what that's going to look like, or indeed looks like. The indications, or the early indications, are that the referrals are likely to be at the lower end of the service, so community-based. They like to be low threshold referrals, which captures the bit that you said, Charlotte, about those individuals who are at home, who are feeling lonely and therefore are getting depressive episodes or anxiety, etc. So that sort of tier 1 type intervention required. In this world that we're talking about this afternoon, it will have an impact. It'll have an impact on those community services, and that's why we will need to look at future investment, which is what I was alluding to earlier on in terms of how we deal with that. I don't anticipate from a clinical perspective, and I only know as much as I know to date. I don't anticipate from a clinical perspective that we will see that escalating into high-level crises amongst a population that we don't know. So I think where it will escalate to that level has the potential, and again, this is in Andrew's world as well, it'll be in those patients who are in our long-term services who have been in receipt of treatment, have been isolated through lockdowns, etc., and there's an accentuation of their psychological or psychiatric presentations needing inpatient admission. Sorry, I don't want to be too technical, but I suppose there are those two perspectives. Those who are coming into the front line of our service, low level anxiety, depressive type presentations because of isolation, they will be front door in the community at the immediate point of access for early assessment, versus those who are already on our caseload, suffering the impact of the pandemic and therefore need an admission for a redress of their treatment before they're referred back into the community.
Yeah, it was interesting in my day job, and I had a call this morning, and the gentleman was manic, and before even giving his name, he was telling me that he was bipolar. And it was interesting to see as the more wound up he was getting, and it was all because he got the weekly collections wrong, and he never put his bins out, but he wouldn't go outside. So I said, have you got the support and things like that? Have you got a caseworker? No one at all. And he was speaking about going outside. He doesn't go outside. He doesn't go outside as much as he can help it, and he gets things dropped off. But the way in which he was speaking is troubling. And if he's not obviously having that support, and this is just an example, then again, how many more like him getting manic over quite small things? So it's just, I think it is a bit of a concern going forward, but as long as we're all there and we're all obviously singing off the same hymn sheet, I think that it will work well. So I thank you for that.
And I suppose that case is indicative of, if he's not on a care coordinated caseload, then he will be those early referrals to primary care services where he's feeling the impact of the pandemic. If he is on the care coordinated caseload, his care coordinator will be escalating that with a potential increase in treatment, which could include admission for assessment.
Yeah, great. Okay, thanks both. Is there any other questions or anything else now that anyone wishes to ask? Andrew, do you want to come back in?
Thanks, Chair. I think it's been really helpful having Sean and Stephen come to the committee. We do work, as Sean said, very closely together. We have got a commitment to work on community services, particularly around mental health, learning disabilities, and we'll continue to do that work and make sure we provide the community services that you as members would want.
Great, thank you, Andrew. Thanks both for coming, and obviously, I'm sure you've got more meetings now that you're going to. So thanks for your time, and obviously we'll see you again in the future.
Thank you very
Thank
much.
you.
Thank
Thanks
you.
very much.
Thanks all.
No problem.
Thank you.
Bye bye.
Thank you.
So now obviously we're going to be moving on to cabinet papers. So if we can just obviously get including myself. I'm the most disorganized, I think, but look. Bear with me. Oh, do you know what? I'll just stick to my notes, to be honest.
It's item 7, Chair, isn't it, on the Cabinet Board papers, the Corporate Safeguarding Group biannual report?
Yeah, just bear with me. It's a little difficult doing all these screens, isn't it?
I know.
Hold on. I'll go back here. Right, okay. So, yeah, so it's 7, because I'm obviously a bit blind being now, and obviously on the agenda. So obviously we've only got questions now are for Karen Edwards, and David Whitlock then will obviously follow Caroline in questions, yeah?
Yeah, do you want to see if officers have anything they want to share before we go to questions?
Yes, I'm
If
sure they
anyone
are.
does.
They always say go straight into questions. Andrew, is there anything obviously you want to say, and obviously the safeguarding?
No, Kerry Warren and Chris Ray Davis, the officers who attend. Kerry Warren chairs the corporate safeguarding group. We'll be here to answer any questions you've got, Chair.
Okay, thanks, Andrew. Caroline?
Yeah, thank you, Chair. Yeah, on page 21 of the report, we've got in brown PASM, P-A-S-M. Can somebody explain what that is, please? Thank you.
I'm sure Chris will be racing to answer that question, Councillor. And apologies because we have tried to explain all abbreviations. It's a professional abuse strategy meeting, so that it's a meeting that's held when there are concerns in relation to professionals. My apologies for not qualifying that in the report.
No problem, thank you. David?
Yeah, thank you, Chair. Get off mute here. Same item on same page, actually, page 21. Looking at the lovely top graph, I love the colours, that's brilliant. But two things stick out. In November, the amount of MISPAs, which has been all year on an average around the low 30s, shot up to 73. Is there any particular reason for that? And the other one is the suspected neglect all the way across the 6-month period was quite high, and I don't know if the two are related, but in November that dropped all the way down to 19. I just wonder if they linked in any way. And the final point, which I forgot to mention to the Chair earlier, I'm going through my notes here. Again, the suspected cases of abuse or neglect, sorry, is there any percentage or figure of how many of them were actually confirmed as neglect? I know it's a 3 hit on the one graph, really. Happy for answers on that?
Yeah, I'll bring Chris in a second. What I would say in relation to the MISPAs is that what quickly skews our figures is if you've got a low number of young people that regularly, go missing. And I always find it frustrating in the way that we actually count missing young people. It's really important that we respond quickly and we would take the same course of action. But in terms of counting youngsters, sometimes we know where young people are. They've literally had a row, perhaps, with a family, with a foster parent, and gone off down the road to cool off. and the regulations state that they have to be reported missing. So if you've got 1 or 2 youngsters behaving in that way, that can greatly skew the figures. I'm looking to see whether, Chris, are you still on the call?
I am, yes, Gary.
Did you want to come in with any more in relation to the MISPAs, Chris?
Yeah, it is that, and the other issue for us, which is noted in the report, which is a strand of work which we're taking outside of the corporate safeguarding group, is the number of children placed within Neath, Talbot, within different care settings, who also go missing, but aren't Neath, Talbot children. So that is another reason for those numbers increasing over certain times.
And just to come back in quickly there, that's been a big task for us during COVID. We have, I think, 13 private children's homes in the area, and we have a responsibility to coordinate the meetings when children go missing or whether there are concerns in relation to those homes. So during COVID, we've seen an increase, obviously, in activity in those homes, given the pressures that they've been under. So that's been a huge piece of work for officers over the last 2 years. And it's always harder because we don't know those young people. They're not Neath young people, but we do have, as I said, a number of private homes in the area. Chris, given my memory isn't what it was, are you happy to field the next question or remind me what it was again?
Yeah, certainly. In relation to the last question about neglect, we do hold conversion rates. So we could say how many went from reports or came in as neglect and then went through the system and then went into the conference arena as continuing risk, and neglect was found as the category. So it would be possible to convert that figure into how many are, I guess, at the best guess, actual neglect, because of course that in itself is a broad definition as to what neglect is. And then on the numbers that you flag, and they're highlighted yellow because this was a discussion we've had in the group, what we seem to have found in terms of that November figure, and we are monitoring the suspected neglect referrals, is that we did have some cover in our front door, and when the reports come in, they are categorized. So neglect can sometimes capture wrongly domestic abuse. So we have looked at that, and we think because we've had some different decision makers, it's therein is the anomaly in terms of the actual neglect category falling in that November month. What I would say for the January, then it's picked back up to about 38, but we'll continue to monitor that.
And just one last point from me. I think that's actually a really good idea, Chris, in terms of neglect and how we account in that. I think that's something we'll take forward. And it was really difficult those months leading up to Christmas. We had to put in a team around the front door, and they're experienced workers, they're experienced managers, but they work in other parts of the service. And what we could see was the difference, not in terms of the difference in threshold of how we were responding, but just the difference in how they were capturing that on our computer system. So, and we could see that it made, so when we checked some of that, we could see that, they were there's different categories, and they counted it differently. But that's something for us to be mindful of for the future.
Oh, thanks. Does anyone else want to come back now?
Just say thank you for the answers, Chair. That was quite comprehensive. Thank you.
Yeah, great. Just out of curiosity, because obviously, Andrew, obviously since you've obviously been the director, I know you've been really keen and have obviously changed a lot. And as you know, I love statistics and pretty charts. So I thank you, obviously, Chris, Kerry, for them. For visual, it's fantastic. Obviously the way now in which obviously you record data and analyze it a lot more, has it actually had any, positive impact, obviously, on, highlighting things quicker or anything like that?
Yeah, absolutely. I mean, Chris and I love it. So the most recent data that we've been able to have in terms of child protection has been so helpful for us. And I think what we've seen is the performance management, sort of information, it's been embedded for some time, and now we've just continued to develop it. It makes a huge difference, and I'm sure Chris wants to come back in, but that's something that we spend a lot of time on. But it's about how you use that information. There's no point in having data for the sake of it, and that is talked about within the teams, and it really does make a difference to the practice. Chris, did you want to come back in?
I think just to echo that point, Chair, in that we really see the benefits and the insights that the data brings to us. We capture a lot, and we are starting to use it more now, and with the teams as well. And I think what we like about it, if we can get it into the visualization or move more into that world, then it's getting the feedback from others as well. It's that process whereby you look at it and see things that I might not, and it's that process that we like with our teams and as a senior management group, because it just enriches our understanding and thinking about what's in front of us. So yeah, the more data visualization, the better for us.
Yeah, great, marvellous, thank you. We were only saying in briefing earlier on, basically most of us have been on this committee now, obviously since elected, so it's been really fantastic seeing how we've all gelled together, worked together, supported together. And that's not just members and officers, it's also our key partners as well. And I think it just goes to show what an amazing director as well that you have, that steer that. And I know, Andrew, you're going to be blushing by there probably. But I think, if you've got a good leader that will adapt and everything else, I think that speaks volumes. And, I only said earlier on that how proud I am of being a member of this council, seeing how much obviously it's developed over the years. So that's my little, thank you today for you. So obviously this one is obviously only for noting. So if we can go on to the carers now. And as you know, I'm going blind, so I know it's number 8. And again, Caroline, you've got obviously a question on this. So, firstly, I forgot, does any officers want to come in? Andrew?
Yeah, thanks, Chair. I mean, it's been this is a really important time for carers, isn't it? Where they've probably the group that have borne the brunt of COVID restrictions over the number of years that they've been in force. The hardest, where they've been left a lot to cope with their loved ones themselves. And so I think it's absolutely right that the committee consider this report here today. We've got Gaynor Richards, who chairs the partnership, who might want to introduce who else is here, Chair.
Yeah. Gaynor, do you want to come in?
Yeah, okay. Thank you, and thanks, Andrew. So people who don't know me, I'm Gaynor Richards, and I'm here in my capacity as the regional lead for carers across West Glamorgan and chair, as Andrew's just said, of the West Glamorgan Regional Carers Partnership Board. I'm joined today by Chris O'Malley, a carer and the vice chair of the Regional Carers Partnership Board. And we also have Joanna Hall-Davis here, who is the Carers Development Officer for the region. And Kelly, I'm very pleased, is still here as well to support when required. So just really very quickly, the purpose of the report, you will have seen the paper, so you know all this. I'm probably going through things you said, is to provide the members with an update really on progress on the implementation of the West Glamorgan Carers Partnership Board, and the annual report is what you have in front of you for the year 2020-2021. You'll have had a copy, and I hope that you will have had an opportunity to actually read through it. The submission of an annual report to Welsh Government is a requirement under the conditions of the funding for the Welsh Government's carers funding. So just for information, you will probably be aware of that, but just to tell you actually that the Carers Partnership Board annual report has already been submitted to the West Glamorgan Regional Partnership Board for approval prior to submission to Welsh Government. So what this report does is to highlight some of the work actually and the key achievements for the Carers Partnership Board during the year 2021. one, and unpaid carers actually will cover our young carers, our young adult carers, parent carers, working carers, and older carers. There's an awful lot of diversity in actually identifying their needs and providing services that meet those. So Carers Partnership Board actually has representatives from carers themselves, from both local authorities, from Swansea Bay University Health Board, the carers services across the region, and the county voluntary councils. You will know better than I actually that Neath Talbot has had the highest number of unpaid carers per head of population in the UK, and that was prior to COVID. I don't know what the recent census figures are saying, but I can't imagine it will have changed to reduce. What it probably will have done is significantly increased. During COVID, the numbers of carers has been significantly increased across the whole of Wales, really. So, but what we are pleased to do today is to actually share some of the very significant progress on support that's been able to be achieved across the region in supporting carers. So this report, again, as I've said, 2021, at a time of the actual COVID lockdown, whole lot of difficult times there. But actually just going to hand over to Chris, if that's okay, Chair, to actually highlight some of those. Thank you. Thanks, Chris.
Thank you, Gaynor.
Hi, thanks very much. And yeah, we are really pleased to be able to share this. It's important, especially for me being a carer as well. We co-produced the Carers Emergency Planning Guidelines to support statutory partners to better support the needs of carers in emergency situations. The document is designed to be able to be lifted into the existing policy and planning procedures. It developed a 5-year carers strategy for the region, and we hope that this strategy will enable the statutory partners to work together in partnership to achieve our vision, which is unpaid carers are identified and recognised and supported to care. They have a life alongside their caring role and have feelings of well-being throughout their caring journey. That's a huge bit, which is so important to my role. Established a carers liaison forum so that we can better be connected to carers and empower them to help and develop better services for the future. The forum is led by carers with support from the region. Councillor Peter Richards is a member, and also 2 CHC representatives are on the membership list, Councillor Galsworthy and Anne Spinks. We funded a number of third sector providers across the region to deliver projects ranging from respite care to care awareness and accreditation. In 2020-21, the following projects and services were funded. The annual report outlines them in more detail. IFC funded schemes, Neath Talbot Carers, Parent Carer Transition Links Officer, Neath Talbot Carer Service, Breaks for Carers, Swansea Carers, Swansea Male Carers Pilot Project, Neath Talbot CBC Young Carers Service, San Neath and District Inclusive Short Respite Breaks for Parent Carers and their families, Neath Talbot Carers Single Point of Contact Carers Triage in Integrated Setting, and Swansea YMCA I Care Young Carers Project. Welsh Government Carers funding has been Swansea Carers Hospital Outreach Service, Swansea Carers Young Adult Carers Project, Neath Talbot Carers Health Liaison and GP Accreditation Scheme, Swansea Council Who's Who and What Do They Do. For the future, to be honest, I've experienced COVID, being a carer myself, and I think that we know that the pandemic will impact greatly on carers in the future, and by focusing on funding projects that are aligned with regional carers strategy and create parity for outcomes for carers across Neath, Talbot and Swansea. What I will add is that, I think that, one of the greatest things that's happening here is that there is a voice, although it is a small one still, there is a voice for carers, and and that it's being heard amongst our partners now within the board. So it's really good, and it has raised my level of awareness, and and I'm really thankful for that. So it's just thank you for the opportunity to come and share this bit of work with you.
Thanks for that, Chris. Listening to you started to get me feeling quite emotional as a carer myself. And I think the reporters are excellent, obviously. I'm quite new, obviously, to obviously the partnership. I haven't attended a meeting as yet, but that's obviously on my priority list now going forward. And it's only because of the time just before Christmas and everything else. So I plan to really sort of step up and support you all as much as I can in that. But as well, it's also people, unless they are a carer themselves, they don't actually understand the emotional impact on it as well. So I can see them again.
It's and yes, yeah. and I totally agree. I as a carer, I'm continuing to be a carer, shall I say? I lost my wife in November through COVID. I've been caring for 8 years, but now I see my role not only sort of to sit here and sort of fight for carers. It is a crusade that I'm on, and I think it's a worthy crusade. And now, if somebody was to ask me in the street, what do I do? I will still say I'm a carer, and that's how passionate I am about it.
Yeah, well, let me tell you, you can come on a good mission with me then. That's no problem. That'll give you a purpose now. Shape up, Charlotte. Do you know what I mean? Gaynor, sorry about that all. I'm not normally a tiny tears. Gaynor, you want to come back in then, and then Caroline, I'll call you back in then.
Yeah, thanks, Charlotte. Can I just say, I think what we've heard is actually anyone can become a carer at any time, can't we? And it's so fragile. And that's why, actually hearing your emotion is actually really helping to make that case known as well, Charlotte. So don't apologise for it. I think it's actually a real show of what...
Oh, don't stand me off again now,
okay,
now.
Right, okay, well, I'll stop there. Okay. But it is about just how fragile life is and how quickly life can change for people. And that's why we have to put every effort we possibly can into supporting carers. And I just want to pick up what Chris was saying about thank you for the opportunity to have a voice for carers. I just want to say, really, that we are incredibly fortunate across the region that as carers lead, I actually have the opportunity every 2 weeks in Silver Command to actually go and present the issues for carers at the very highest level. And I want to say thank you to Andrew particularly here today, because Andrew, Sian has just left, and Dave Howes and Kelly, of course, who is here, gives us the opportunity to take those issues to the very highest level quickly. And I just want to say thank you, because I don't think always people understand how difficult it is to navigate a system. So we have that voice, and we have it regularly, but the campaign has to go on, doesn't it? But for me, one of the biggest concerns, I'm sure is felt by everyone here, Andrew must be sick of hearing me saying this, we do work with thousands of carers. So I think Neath Talbot Carer Service is in touch with over 2,000, and in Swansea it's something like 3,000. But we know there are at least 50,000 unpaid carers across the region. We know that. So this is a job that started, but there is a huge amount of work to be done. And your support and the implementation of regional strategy locally is absolutely critical. So just want to echo what Chris has said about thank you, one, for this opportunity, but also to Andrew and the team for every 2 weeks getting that opportunity. It's also really good to have Peter Richards in the Carers Liaison Forum as well, and we look forward to having you there, Jan.
Oh, thank you. I'm sure I'll lighten the load there.
You can.
I'll start fighting with you all. I don't know which one it'll be. But Caroline, thank you for that, Gaynor. Caroline, if you want to come in, sorry. You waited a long time.
If I could get a word in,
I know, come on.
Thank you, Gaynor, and thank you, Chris, for the report. Excellent report. And I just want to echo what you've all said, really, you know, as I've been a carer. And on page 78, 77 of the report, you've written here about the GP accreditation. And I really welcome that, because, you know, GPs live in their own little ivory towers, don't they? Be careful what I say here, but I have worked with GPs for many years. And it's really good to see that, because as you've just said, Gaynor, you know, getting through bureaucracy, you do the caring, okay, but it's when you have to fight with the hospital or the doctors or whoever that makes that life even more difficult. So I'm really glad to see that there. I'll shut up now. Thank you.
Thanks, Caroline. Well, again, thank you for a really good report. Once again, apologies for emotion. And thank you, obviously, for coming as well, everyone. So obviously, I got to move on now. Obviously,
yeah. That one's just for noting as well.
Yeah, and that's just for noting. So, Charles, you don't know. Right, okay. So, the next thing, and I got to apologise. Maybe we could have brought you in a bit earlier, to be honest with you, Kelly, because obviously we've said that we're not obviously scrutinising Agenda 9, but it was such a real excellent, comprehensive report. I just wanted to basically commend you on that, because it is a really, really in-depth, and obviously it shows how good it is, because, and as well as all the other reports, there's not very many questions, and that always shows the quality of reports obviously coming to us. So is there anything obviously that Andrew, you would say, or Kelly, meaning you waited all this time, if you want to come in and say even a hello? So it's up to you. There she is.
Hi, Charlotte. Yeah, no, thanks very much, Chair, for that. That's great. Just to say, we had a lot of support from the Health Board and from Neath Council and Swansea Council in putting this together, and it was tidying up some of the infrastructure that we had and making sure that it was clear for everybody on how we do things. So I'm glad to see that there weren't any questions, because that means we were clear with what we were taking forward. So yeah, that's great. I just wanted to stay to support Gaynor in terms of the carers element, because clearly it's part of the West Carmarthen Partnership as well. So it was important that I stayed for that section. But no, unless there's no questions, then that's great.
Yeah, fantastic. Thank you, Kelly. Andrew, anyone else want to come in? No? Right, okay. I did say this was going to be the quickest ever meeting, didn't I? I think I'm eating them words at the moment. Item 10. Charlotte?
Yeah, Chair, item 10 is the Disabled Facility Grants item. I think it's Rob Davis.
I should have turned over.
No, it's okay.
Yeah.
I know we've got questions from Councillor Wilcock, but
yeah.
I'm not sure whether Rob may want to come in first, or Andrew or Angela.
No, we'll go straight to questions, Chair.
Yeah, so Adwen?
Yes, thank you, Chair. I did submit the question in advance, so I don't know if officers have had an opportunity to do a look at them. And rather than me going through them all again, if you have the response, then I'm happy to receive that straight away from you.
Angela, do you want to come back in on that?
Yes, Rob's got the response ready.
Oh, right, okay. I see you nodding, so I can't see Rob.
Yeah, that's fine. The first question was to apply once a year, I think it was, wasn't it? I think it was your first query. So
yeah, that's right, Rob. It says 1 year per year. I'm sure it's a rogue year that slipped in. It is. Just wanted to clarify that. That's all. Yeah.
It is. Yes. Yeah. Basically, what we were saying there is that the applicant could apply a maximum of 1 application per year. And your second question regarding the payback, you're saying that referring to if their circumstances change further down the line. I can refer you back to previous cabinets where we put waiver requests in. So we got discretionary powers. So if people's circumstances change and they have to, they break the conditions of the grant and they're not in a position to repay the grant for whatever reason, then we've got discretionary powers which we can use to waive a grant if necessary, if they tick the right boxes.
Yeah, thanks for that, Chair. It just confirms what I suspected, but it's nice to hear it anyway. The only other one that, and I did mention this in briefing, Chair, that I wanted to comment very, very briefly on, that's on page 32, and the comment there that all other authorities are trying to have an uniform approach to this, particularly the neighbouring authorities. Yeah. So that's good to hear. Otherwise, of course, it becomes a lottery, a postcode lottery rather. So I'm glad to see that. Thank you, Chair. Thanks Robert, for your response.
Sorry, could I just quickly respond to that? It was getting to a point where the authorities were all looking at doing something totally different. But now that everybody's got their own legal advice, like John Hodges has advised us very closely with this, and all the other authorities have all taken their all advice, and basically everybody has come back to now pretty much exactly the same conditions. It is varying slightly in Wales. Some people have decided to remove the means test completely from all grant applications. Other people are welcoming the additional demand because some authorities don't spend their allocated budget. So people are tweaking it slightly to suit their authorities. But the majority of authorities are all going to the same conditions now, which is the legislative conditions. So it does make life a bit easier for everyone.
Okay, thank you. Anyone else? So again, that's obviously for noting. And we'll move on. So obviously the final thing we've got for you now is obviously the forward work programme, Charlotte.
Yes, Chair. So that is just for noting really for members, but just to make members and officers aware, obviously the pre-election period will be coming up around the 25th of March. So after that, there'll be a few cancellations of the meeting. So I'll be discussing, I've obviously discussed the forward work programme with members, but I'll be discussing with officers as well outside the meeting, just some of the amendments that we may have to the forward work programme.
Yeah, and basically that there's no urgent items. So
no, Chair.
That is bringing the meeting to the close, and thank you all.
Thanks, Chair.
Councillor Goldsworthy, well chaired.
Oh,
Thank you all.
I'm
Bye.
I can do now. No. See you all.